Joining me today is Dr. Charles Regalado. Dr. Regalado has been practicing dentistry for 20 years in the state of Washington. Dr. Regalado, what is periodontal disease and how does it correlate with overall health?
Wow, what a subject. If I could wave a wand and get rid of one thing, it would be periodontal disease. What it is basically is an advanced stage of what starts out as just simple gum disease, gingivitis, a simple gingivitis, when your gums are a little bit red, a little bit bleedy, and your dentist or hygienist mentions that to you. For a lot of people, they see it as no big deal. But what we do know is that in the vast majority of people, it will progress to some form of a deeper, more advanced disease. So periodontium basically is Latin for around the tooth. So it's an inflammation caused disease of the tissues, bone, and the gum tissues around the teeth. The way it correlates to health is interesting because for years people would think that it was just located here. But what we know now, and it's well established by university studies, is that what happens here, the inflammation, means there's inflammation here and here and here and other organs, especially the heart. It has a profound effect not only on whether you're going to keep your teeth for the rest of your life, but it has a profound effect on your overall health.
And longevity?
And longevity.
Wow.
The studies have been pretty plain and pretty clear. People who keep their teeth live longer than people that don't. It's plain and simple.
And 75% of Americans, adults, suffer from this, as I mentioned earlier.
Yeah, 75% of people get this because, again, some form. That doesn't mean it affects every tooth in their mouth. It can be isolated. You could have periodontal disease in a certain section of your mouth, or just a few teeth can have it at the worst. It has a very huge genetic component, and so usually comes on in the 30s. In the normal type of periodontal disease.
I would have to believe that some of the risk factors would just be your eating habits, because we're talking about things getting there along the gum line, correct?
Yeah, some of the things like that we've all heard forever, brushing and flossing, it gets a whole new meaning all of a sudden.
Yeah.
And certainly the risk factors are the same for other types of diseases. You know, smoking is well, people that smoke generally just aren't going to keep their teeth. That's just, the periodontal disease will progress pretty well in those patients. Obviously alcohol, diabetes, these type of diseases. And of course, just lack of good home care.
Coffee too? I mean, we're a coffee drinking society, so how much of a factor is
well,
coffee?
yeah, if you drink coffee, there's a little bit of you're in a little bit of luck there. There's not a huge connection between the coffee and periodontal disease as there is with alcohol and smoking.
Oh, okay.
So.
Warning signs. If you're looking at the mirror when you're brushing your teeth, there's something you can spot that says, maybe I'm at risk, or maybe I have the beginning stages of it.
Yeah, it's pretty, it can be simple in one regard, and it can be very difficult to figure out if you've got it. Do your gums bleed? That's basically it. If they're bleeding, you've got inflammation. If you've got inflammation, you're not winning the battle here. And so that's the first early sign. But periodontal disease also is known as the silent disease in the dental world. So what that means basically is a lot of people have no idea because there isn't pain involved with it necessarily.
How about treatment options?
You've really got to get beyond just a routine type of a cleaning. A lot of people come in once a year, twice a year. If you've got periodontal disease, you're looking at a cleaning schedule of 3 months, every 4 months. You've got to go in there, and your dental hygienist needs to go below the gum. Sometimes you'll need to have anesthetic during your cleanings, which is something you're not used to having if you haven't had that before. There are also, in advanced cases, we send you to a periodontist, and the periodontist role is to apply the latest methods and the latest technologies and science to really get at these bacteria. We find these bacteria are extremely resistant to just normal cleaning, even as your dental hygienist does. So we need the periodontist. They're our great friends in the advanced cases.
Is periodontal disease reversible? If you have it, can you get rid of it?
It is not reversible.
No.
No, it is not. You can stabilize it, which is the good news. So gum recession, bone loss occurs in periodontal disease, so you have people with a lot more spaces between their teeth, and which causes a problem on its own. And you can stabilize it with the kind of care I'm talking about. You cannot stabilize it if you're getting your teeth cleaned once or twice a year.
Well, how about prevention methods for people starting out? So maybe I don't want to get this. Obviously,
Yeah,
you don't want to get
you
this.
don't want to get
How do you
it.
prevent it?
You know, it's a tough situation for some people because of the genetic component to this. I had a man in my chair who flosses twice a day, who brushes all the time, who sees has been seeing a periodontist, and yet he's still, you know, progressively getting worse, and he's at a loss. What do I do? And he said, I never had it before. He's only in his 30s. And well, that's the time it happens. There's a big genetic component to this disease. So in those situations, there's not a lot you can do because of genetics. However, you know, getting you've got to be a great flossing, getting in between your teeth. I love things like oral irrigators. There's a whole new brand of oral irrigators out there that some are magnetic. They run through a magnetic stream. I use them a lot. I've seen great success. They have special small tips that will go into deep areas. So that's going to be a really key. And of course, if you're a smoker and in excess of alcohol, things like that, diet, stay away from those bad, harmful things like sugars and carbohydrates that we talked about. And that's the best way to prevent that.
Something not to be taken lightly.
That's right.
All right, Dr. Charles Regalado, thanks very much.
Thank you.